Queensland's COVID-19 rules are about to ease further after health authorities announced a change in isolation rules for household contacts and unvaccinated international travellers. Since the onset of the COVID-19 pandemic more than 2 years ago, any household contacts who test positive to the virus have been made to undergo mandatory isolation across Queensland. But as of 6 p.m, those isolation orders will be scrapped for asymptomatic household contacts, along with the quarantine rules for international arrivals. Here's a breakdown on the latest shake-up to Queensland's COVID rules. Who is a close contact? You are considered a close contact of someone who has COVID-19 if you are living with someone infected with the virus. You are living with someone infected with the virus, you have spent 4 hours or longer with someone in a home or a health or aged care setting since they developed COVID. Do I need to isolate if I'm a household close contact with symptoms? Yes. Health authorities say anyone with COVID symptoms is still required to get tested and isolate at home. Symptoms include fever, cough, runny nose, sore throat, fatigue and loss of taste or smell. Do I need to isolate if I'm a household close contact with no symptoms? If you are asymptomatic, you will no longer be required to isolate for 7 days. Instead, asymptomatic close contacts will be required to test for COVID every 2 days. This can be done via either a rapid antigen test or a PCR test. M to mute, left and right arrows to seek, up and down arrows for volume. Watch 4 minutes 41 seconds 4 minutes, and 41 seconds. Epidemiologist warns of rising case numbers as restrictions ease. But of course, if a close contact returns a positive result on the tests, they will be required to isolate for the full 7-day period, regardless of whether they have symptoms. Close contacts with no symptoms will also be required to wear a mask for 7 days when indoors, as well as when they are unable to socially distance outdoors. Can I go to work or school? The Queensland Government has advised close contacts to work from home for 7 days if possible. Close contacts are also required to inform their employer that they are a close contact before returning to work. If you are a close contact who works in a vulnerable setting, such as at a hospital or aged care centre, Health Minister Yvette Dieth said extra precautions will be taken for those workplaces. In vulnerable settings, we will MAC